And this station is about critical thinking. So just enjoy some self-learning, self-teaching, team teaching, and let's talk about critical thinking in EMS. In no way, shape, or form does this course or discussion change your protocols or your certification, your level of care. So some divergent type scenarios that we see all the time and how we can approach them from a critical thinking standpoint, right? With slurred speech, you should probably be thinking something in the lines of stroke from the most important, and then there's obviously different kinds of stroke mimics, and what do I have to do next to assure the patient has the best outcome, and then how can that help, how can it hurt, so what information do I need to know? And this should all be pretty much already organic in your mind. Soon after you graduate school and you start to see a few cases, you start to build these kind of automatic critical thinking algorithms. So what do I do as an EMS provider to save brain and life in a slurred speech stroke presentation? And this is important, right? Because this, if you know this, then it helps you critically think to, well, what do I need to do next? What do I need to know next? As opposed to like a major trauma, right? Someone with pain looks very ill. What do we do as EMS providers that help save that person's life, move it to the next level of care, as opposed to brain tissue in a stroke? Very different presentations, very different things we do. And within trauma, there's the subsets of an isolated trauma that I can definitely do an intervention that saves their life or definitely increases their likelihood of survival versus critically ill multi-system trauma or penetrating trauma that requires the surgery and advanced intervention. These are the kind of things that change what we do, what we need to know in its hierarchical form of most important, lesser importance, not really all that important in the time we present. So just as a general reference, right? Ischemic versus hemorrhagic versus stroke mimics and things we can do. So stroke mimic like hypoglycemia, we can intervene in the field and do a great job with. Ischemic versus hemorrhagic stroke, it's more time and getting as much information to the experts as we can. In your case, maybe a stroke truck, and other EMS venues, it's more, I need to get all the information that the physicians will need and do it in a timely manner from the most important to the least important in case I run out of time. And simultaneously do what I can to assure it's not a stroke mimic, because the critical interventionists at the hospital are really going to rely a lot on me because it's a very time-sensitive thing. Whereas in trauma, it's the lethal triad, right? Stop or slow life-threatening bleeds and life threats. How quickly can I get them to an intervention and get them to the correct intervention in the correct amount of time, keep them warm, and physiologic support for bleeding, airway, and things like that. So basically traumas, stopgap measures and do what we can depending on the type of trauma. Stroke is ischemic versus hemorrhagic versus mimics, and making sure we get as much information as we can. So these are the kind of things we're going to speak through. You're going to go through the case as presented and write down what you think so that we can all go over it at the end of the day. So thanks for putting some time and effort into it.